Welcome everyone to the Assets Supporting American Indian and Alaska Native Students on their Career Journey webinar. My name is Satima. My tribal affiliation is Apache. I'm a third-year undergraduate student at UCLA, and I'm on the pre-medical path with the goal to serve as a neurosurgeon and a healer for Indigenous communities. I participated in SHPAP in summer 2023 at Columbia, and I'll be hosting our webinar. We're thrilled to have you join us for this special session. We aim to unlock the full potential of your health professions journey, and in today's webinar, our focus is on providing dedicated support to American Indian and Alaska Native students. This webinar is more than just an informative session. It's a unique opportunity crafted specifically for American Indian and Alaska Native students. We understand the distinct needs and challenges that you may encounter on your career path, and our goal is to empower you with the right resources and insights to overcome them. Throughout the webinar, we will delve into a wealth of information designed to enhance your career journey. From specialized resources to tailored insights, our speakers and experts are here to guide you. Whether you are a student aspiring to enter the health professions field or already navigating your career path, this webinar is your gateway to valuable assets that will shape and support your success. And next, I would like to take some time to introduce our speakers today. Dr. Nicole Stern is a member of the Mescalero Apache tribe of New Mexico. She is the first member of her tribe to become a physician. She earned her medical degree and completed a residency in internal medicine at the University of Arizona College of Medicine in Tucson. She was a fellow in primary care sports medicine at the University of Oklahoma Health Sciences Center in Oklahoma City and has a master's degree in public health management from Harvard Chan School of Public Health. She was a Commonwealth Fund Fellow in Minority Health Policy at Harvard Medical School, and her practicum project focused on American Indian physician workforce development. Currently, Dr. Stern is an assistant professor in the Department of Medical Education at the California University of Science and Medicine, while working part-time as an urgent care physician. She's a fellow of the American College of Physicians and the American Medical Society for Sports Medicine, and she has extensive experience with the Association of American Indian Physicians, AAIP, having served as president-elect, president, immediate past president, and two-time at-large director of the board of directors. As a recent liaison from AAP to the Association of American Medical Colleges Committee on Student Diversity Affairs, Dr. Stern continues to serve on national committees with the AAMC and other organizations to collaborate on strategic plans and initiatives that emphasize the importance of including American Indians and Alaska Natives within the national conversation around healthcare workforce development and medical school diversity. Dr. Tamina Bunny Begay is of Navajo, Seneca, and Mohawk descent, and she was raised in Portland, Oregon, with summers spent on the Northern Navajo Reservation. Dr. Begay began her college career at San Diego Mesa Community College and then transferred to the University of California, San Diego Rebel College. She graduated in 1999 with a Bachelor's of Science degree in biology and minors in art history and psychology. In 1999, Dr. Begay enrolled in the University of California, San Francisco School of Dentistry's post-baccalaureate program. Following this program, she began her graduate studies at the University of Pacific Degoni School of Dentistry in San Francisco. After earning her DDS in 2003, she began working with Indian Health Service. Dr. Begay currently works as a supervising clinical program director at the Gallup Indian Medical Center in Gallup, New Mexico. She is involved in several local and national organizations promoting American Indian and Alaska Native students into higher education and professional careers. And with that, I'd like to turn it over to Dr. Stern and Dr. Begay.
Good morning, everyone. This is Bunny Begay, and as Satima mentioned, I work at the Gallup Indian Medical Center, and I'm also a part of the Society of American Indian Dentists, and we'll be presenting to you with Dr. Stern.
Hello, everyone. Thank you so much for joining us today.
So both Dr. Stern and I have been involved with working on student programs for a number of years, and we had some things that came up particularly over the course of a few decades that we've discovered, and that's what we want to share with you today. The first thing we want to talk about is leaving your comfort zone. We know that for a lot of American Indian, Alaska Native students, that leaving home can be, for some, very devastating and a huge hurdle to have to overcome. Whether you're coming from a small community in which you're more remote, like maybe on one of the reservations, or maybe you grew up in an urban center, but the Native community can still be very small in those areas. So leaving your comfort zone and having to come to a new environment and leave and go to school is definitely something we want to discuss further, and also talk about what you can do and give you resources to find your community. Some of the things that come up are, for me, I know that I looked for an Indian Health Service clinic when I went to college because I knew that Indian Health Service was always kind of a hub for a lot of resource departments and for American Indian and Alaska Native peoples. So for me, that was the first thing I did when I got to San Diego from Portland, Oregon, was look for an IHS, and got hooked into a number of resources because of that connection. The other things that we want to talk about that's an element of change is academic support. Finding resources can be daunting, maybe a little easier now with the internet. But in the time I was in school, it was just word of mouth. And a lot of times that's how a lot of things get passed on. So finding out about resources from peers is going to be key. And we're going to talk about some of the resources, hopefully, that you can gain from this and that you can share with your peers on campus. One of the other things that we want to discuss are finances. And I was really glad to see that there's actually going to be a whole session after this in a few hours regarding financial literacy. So stay tuned for that. But for American Indian students and Alaska Native students, many of them have tribal resources that they can tap into, whether it be scholarships or some tribes have more availability to offer full grants for monies to go to school. Student loans, an issue that trying to navigate that and understand what all the different terminology means is something that they'll go over in financial literacy. So you'll definitely, like I said, want to stay tuned this afternoon and go into that session. So this is an area Dr. Stern and I can both discuss here, is the importance of role models, finding people that necessarily aren't in your own community per se, but finding people that can be personal role models as well as professional role models. We have a lack of American Indian dentists and American Indian physicians in this country. So sometimes finding those role models to ask questions, to find out what the next steps are. That's what we're here today, hopefully, to discuss and be that kind of conduit of information. Dr. Stern, do you have anything you'd like to express about role models?
Yes, I think back to my early college days and having the opportunity to get engaged in clubs and organizations in college, and I was able to be connected with a role model who was someone who was starting medical school when I was starting as a pre-med, and that was really key. So depending on where you're going to college, I think it's important to kind of reach out and see if there are American Indian or Alaska Native students that are in health professional schools, or even senior college students that who you could seek out. So I know for me, it was really beneficial to connect. Where I went to college, we had a big SIB, a little SIB program, so I was able to connect with someone there. And then following that, I participated in an American Indian pre-admission workshop, which we'll discuss later, sponsored by the AEIP, where I was able to meet older role models who were great, who I maintained connections with for a long time afterwards. And from a professional standpoint, I think that was really important to meet family practice doctors, internal medicine doctors, meet specialists. So when I was going along in my career later on with medicine and then in medical school trying to think about a specialty, it was really important to to gain that experience. And sometimes I would shadow them, but sometimes I would just talk to them on the phone or connect with emails. So
Yeah, I too had a similar situation in which I had great personal role models. For me, it was my grandmothers and kind of what they have done in Indian country. And they inspired me to seek a career working amongst Indian people. And professionally, like Dr. Stern, AAIP was a very influential part of my journey in finding those role models to speak with. Something that often comes up, imposter syndrome. This may be the first time you hear of this term, but it's an important term because there's many times, especially I hear it from most of my students that I've mentored through the years, that do they really belong? Do they really belong in a number of ways? Are they native enough? Are they smart enough to be a doctor? Are they smart enough for scholarships? You question a lot of things and wonder, if you are enough of any given factor. That we're here to tell you you are. You are definitely going along this journey, and you're not going it alone. If you feel that you're going it alone, that's an important time to step in and find a role model to help you along your journey. Dr. Stern, would you like to add anything?
I think the only thing that I would add is going along in your career as you get further, and if you have an accomplishment, and I know it's very much not part of our culture to brag about oneself, but to practice humility. And I think that's really important to maintain that humility. But also, if you have achieved an accomplishment, make sure people know about it. Make sure you put it on your resume, your CV, and you talk about it in interviews, because it's important. Because I think a lot of women, I think primarily, but also members of underrepresented minority groups, tend to downplay sort of accomplishments that we've had, and then that's really part of the imposter syndrome. Like, I'm not good enough, or I don't deserve that promotion, or I don't deserve that raise, and I haven't really done that much. And so hopefully we can get away with that as we move on and our country becomes more diverse.
Definitely. And as you said, it's a career long, from being a student to being a professional to, in that arena, being a professional, maybe going from being a clinician to being an administrator onward. You're going to often come across those questions in your own head, hopefully, that you're not enough, but you are. And we want to enforce that. So now we're going to go into some resources and finding your communities on campuses across the country, whether you're at university, whether you're at college or tribal college. It's important to know all the resources that are available to you and finding that community, because community, you left one, you're coming to another. It's important to find those support systems that are going to help you along the way. So the first one we're going to discuss is organizations for MD-DO students. And Dr. Stern, take it away.
Great. So we have two national organizations, one called the Association of American Indian Physicians, and the other one is supporting students, the Association of Native American Medical Students. But what I want to point out is that we have members such as Dr. Begay and other members who are health professionals of the Association of American Indian Physicians. So you don't have to be a physician achieving an MD or DO to be part of the organization, but there are a few different membership categories, and we welcome and actually encourage other health professionals to join our organization and to utilize our resources and our programming for health professional students. So it's not MD or medical student only. The same thing goes with the ANAMS organization. They wholeheartedly support all members who are students, who are podiatry students, students who are dental students, physical therapy, pharmacy, etc., who can be members of the organization.
That is true. And thank you guys for always welcoming me as a dentist into the physician world, because we know that there is a connection, obviously, between dental and physical health. It's part of physical health, but you guys have always made other professions feel very welcome. So thank you.
So what I'd like to highlight, and when I give presentations nationally, is talk about AAIP student programs. I didn't have a slide on our National Native American Youth Initiative program, which is a high school program. If there are any high school students listening, that is an opportunity for, I believe, sophomore students, and we're going to be bringing that program back in this summer of 2024. So look out for that. It's called the National Native American Youth Initiative. But for college students, those who are interested in exploring health professional fields, you would start with the American Indians Assessing Health Professions program, which is for all pre-health students who are tribal or community college members, students, or if you are early in your college or university career as a first year or second year, then we would like to attract you to that program. That's I'll explain a little bit more about that program in just a few minutes. The pre-admission workshops as well are for the applicant-ready student. So the student who is ready to apply to medical school, this is the one that you want to attend, and we have a few of them every year. And mentoring students interested in health, medicine, and other health professional fields is really important. Dr. Begay, have you had an opportunity to mentor some students?
Yes, I have. And I wanted to also add that these are programs that are free. Is that correct?
Yes, they are free and fully funded, and the students can apply for free and attend for free, and transportation and housing and meals within the activities are all provided for free.
Excellent. It's a very good resource. Here are some others.
So just to mention the pre-admission workshops, so the few that we have going on, the Four Corners Alliance has been going on for many years now in Arizona, New Mexico, Utah, and Colorado. So between the 5 medical schools, there's 2 in Arizona, and then the other states. It is a 2-day program, and you don't have to be from one of those states to attend the Four Corners Alliance, but we do try to attract students from that region to attend. It's usually held in the spring. This year, we're doing a virtual format where there are several sessions starting as early as last week, all the way through, I believe, until June. So look at the AAIP website for that. The University of Minnesota has been running a successful pre-admission workshop at the beginning of our Association of American Indian Physicians annual meetings, usually in the summertime, and the Center of American Indian Minority Health in Duluth sponsors that. SUNY Upstate New York ran a successful pre-admission workshop for a few years, and I believe they're continuing to plan for the next one. And then institutions are invited to collaborate with AAIP to sponsor one. So if your institution is interested in sponsoring a pre-admission workshop, AAIP raises money from organizations and institutions to support this. And we bring about 20 students every year to the pre-admission workshops, and it is free, and we ask for small donations to support it. So it's a great program. There's just a couple of pictures of one of our programs in 2017, some students participating from many different states. We had 19 students that year.
Great picture.
And then this is a program that's near and dear to my heart that I started back when I was president of AAIP in 2012 to 2013 to 2014. And so the program is for the pre-health students, so early college, tribal community college. And we need more American Indian health professionals in many fields. So it's a lot of information over 2 days about public health, nursing, dentistry, medical school preparation, how to finance your health professional school. We talk a lot about summer research opportunities. We talk about preparation and skills that are really essential to taking tests. We talk about post-bac programs, and we talk about internship programs. So it is focused sort of on the Western region, and most of the schools are from California, but we do open up to other institutions such as Nevada, who was one of our first hosts. And so this shows a timeline of when we started it back in 2013. We did a pilot 1-day project as part of the Association of American Indian Physicians. It started the day before the annual meeting, University of Nevada. hosted that one. And then they were so excited about it, they hosted an in-person one at UNLV. And then in year 2, UC Davis, year 3, UCLA, with UC Berkeley as a co-sponsor. And that was actually at Berkeley. And that was public health focused. And then year 4, UCLA was the host at David Geffen. And year 5, UC Davis hosted virtually, Riverside hosted virtually in 2021. Stanford hosted the first in-person one after the pandemic. And it was at Stanford. The last one was at Western University. And then our next one will be at UCSD in San Diego in 2024. So look out for information coming in the next few months about attending that one.
I'm very proud. I was a UCSD grad, so I'm glad to see that they're going to be hosting a program this summer. Here are some
There's a
more
couple of pictures. I think it's always great to kind of see the group. There's our Stanford group from August of 2022. And that includes students at Stanford that volunteered their time, pre-meds and medical students, as well as the whole group of students. I believe there were 17 or 18 students that year, and some of our faculty members in front and sponsors from Stanford. And then at Western University, here's a little picture of students practicing some CPR techniques on pediatric patients.
All right. Thank you very much, Dr. Stern. And at aaip.org is where you'll be able to find more information on any of those programs in depth and about applying to those programs. So definitely look into that. I'll be speaking to you about the Society of American Indian Dentists. So those that are pursuing a DDS or DMD degree, the Society of American Indian Dentists has a very robust student membership program. There's only one school that has a student program, and it's just because the numbers at most schools are so small that they're unable to have a student club dedicated to the Society of American Indian Dentists. But if you do apply for membership, it's only $25 to be a student member. And one of the things that's going to get you are email blasts regarding student opportunities. And some of the opportunities that come up often are pre-admissions workshops, the DAT prep. We have scholarships that are specific to that. The information for scholarship to come to the annual conference where we have a student fair with the schools. And some of the schools that do the pre-admissions workshops in the past have been both the University of Buffalo, the University of Minnesota. There's some programs coming out of Detroit Mercy School of Dentistry. All of those things you can ask questions about, especially tomorrow during the virtual fair where we're going to have Society of American Indian Dentists will be represented. So definitely visit the virtual fair tomorrow. And one of the key things that comes out of being a student member is the opportunity to speak with a number of dentists and to create mentorship relationships. So some people might be really great at academic coaching for you. Others might help you with inside scoops to some schools. So we mentioned role models before. Like Dr. Stern mentioned, it's nice to be able to be at a conference or have the connections to people from different aspects of the field, because dentistry, like medicine, there's 9 specialties in dentistry. You may not know of all of them, but you may want to find out. You may want to have the opportunity to go and shadow at a tribal clinic or an IHS or a private practice. So something to definitely consider. And all those opportunities are available to you. So definitely take a look at www.thesaidonline.org so you can get more information and visit the virtual fair tomorrow. Now, as undergrads, there's some opportunity on many campuses to be part of a science-based organization. Many students that come through the pre-dent and pre-med route or just pre-health profession routes are studying a STEM-related degree. So whether you're doing biology, chemistry, physiology, these are 2 organizations that have a lot of resources for students, really fun conferences to attend. It's good to find, like I said, that community, finding those people that can help support you in your journey, whether it be peers, that's always important to find. Whether you're wanting to look for some professional development, they offer that. They offer education on research opportunities, and they often have very large career fairs. So some place where you can go and kind of engage in things that maybe other students wouldn't have the opportunity to find. You can attend ACES or SACNAS. This year, the conferences for ACES will be at the San Antonio, Texas Conference Center. That will be in October. SACNAS will be in Phoenix, Arizona, October 31st through November 2nd. And both of them have very great websites with a lot of resources for students. So if you don't have a club on campus, maybe there's a neighboring university that has a club that you can be a part of, but it's a really great resource to connect. So one of the key places where you can find information on your campus is your pre-health advisor. Some schools have them, some don't. Some have pre-med routes, some don't. Some have pre-dental routes. So Dr. Stern, if you can talk a little bit about the advantages to being part of a pre-med club. Did you take place in a pre-med club on campus when you were in school?
Yes, I did. I participated in our Native American pre-med club in college and then ended up becoming the president of it. So it was a really great group. There were a small number of us, I think maybe 8 to 10 of us in that pre-med club. And we were able to help each other to learn more about opportunities to participate in pre-health activities. And then I also learned about an opportunity in college to volunteer as a student at a homeless clinic, which was a great opportunity in college to just get me exposed to another area of patient care, which was wonderful. And we did have, I believe, 1 or 2 guest speakers who came in as part of a larger medical school activity who are American Indian physicians with many years of experience and practice. So it was great. And we participated in our big powwow in college, which was fun as well.
That is a fun powwow during Mother's Day weekend. Stanford powwow.
Yes.
So I know for myself, we had a very large pre-dental club at the University of California, San Diego. And that was really where I got a chance to see some of the specialties within the field. And I shadowed at the local Indian Health Service in San Diego, but it really broadened my perspective because of the different speakers we would have, talking to students about their experience in dentistry and what they would be able to bring to a given class. Being part of organized professional societies also was something that was highlighted in our pre-dental club. We carved teeth, we had sessions that were really geared to things that you would do your first year of dental school. So finding that and being part of that is important. If you don't have a pre-dental club or a pre-health professional club at your campus, look for something that's related, pre-public health, pre-med. They're also going to be able to be a really great place to find resources and peers that are studying along the same line as yourself. Some of the national educational resources, the AAMC, who is hosting this session, which is the Association of American Medical Colleges, as well as ADEA, the American Dental Education Association. I know ADEA has a section on their website for Go Dental, and it's a great resource for pre-dental students to take a look at schools, kind of in-depth information on them and some of the pre-dental pathways that are out there that we don't always hear of. It may not be geared specifically to American Indian Alaska Native students, but might be in your own backyard, might be held at your university or one nearby. So it's good to check both of those websites out. Now, Dr. Stern, you touched a little bit about the cultural club that you were a part of at Stanford. Could you talk a little bit more about that opportunity and what you gained from it?
I think the biggest thing was finding a community when I was a freshman of students to hang out with and who had similar interests. So we had a big SIB, little SIB program at Stanford. So it was medical students at Stanford connected with pre-med students. And we connected for all the years that I was there. And we also would meet at the Native American Cultural Center, which was a big community center for American Indian and Alaska Native students to come and meet on campus. So that was really wonderful. And I was not really involved with any public health clubs. I wonder if Satima, as a current student at UCLA, if you've had the opportunity to participate in any clubs so far.
Yes, I am a member of our ACES chapter. Through ACES, I was able to develop leadership skills through serving on the board. Attending the national conferences has been very helpful with getting exposed to different resources, such as AAIP and other universities that are there to share information. And we also focus on advocacy. So I highly recommend getting involved in your ACES chapter, even like your Native Student Association. At UCLA, we have AZA, which is American Indian Student Association, and we also put on our annual powwow in the spring, and we host youth conferences where we can give back and mentor Native youth.
That's important, Satima. I like that you mentioned about the leadership skills, because that's something that you really do gain from being a part of many of these clubs. Maybe your freshman year and sophomore year, you're just participating, and then junior year, senior year, taking up some leadership roles, whether that be with ACES or pre-med, pre-dent club. Really helps you kind of hone in on a professional identity. And many of them do volunteer work out in the community. So that's always a plus, especially in terms of applying to professional school. So the reason we wanted to talk to the students today is because it's really about creating community. You being a part of any given class, you're going to bring a uniqueness, a particular breadth of knowledge that a lot of students aren't going to have encountered before. You might be the first Native student that another student has met. And where you come from and your background is essential in helping our community grow. And we're here to assist you. Dr. Stern, any comments?
Yes, I think that's the most important thing. I think it's very isolating if you're a student and you're the only Native student in your college, or you're part of a very small group, or you come from a reservation or a community where not many students or people have gone on to attain health professional careers. I think it's really important to find that community and just know that AAIP and Society of American Indian Dentists, and there may be other American Indian health professional organizations. I believe the nursing organization is very large and very active. So it's really important to find those national support systems, but also important to connect with your own community as well, and maybe reach out to your tribal education person and see if there's opportunities that you may not be aware of. And also funding and scholarships is really important to stay connected to your tribal community.
So we're going to open up for questions and answers here. So Satima, if you can look at the chat for us and let us know if there's any questions for either Dr. Stern or myself.
Do you all share about your favorite aspect of your career?
Go ahead, Dr. Stern.
That's a broad question. Favorite aspect of my career, from at what point? So I enjoy being a doctor. I practice sports medicine in addition to internal medicine, but I actually work in an urgent care facility. So the most exciting thing I like about urgent care medicine is that I can take care of things really immediate, and I don't have to be concerned and get bogged down in paperwork and continuity care. I can really address someone's immediate medical condition right off the bat. I love taking care of athletes. I've worked at the high school level as a team physician, college level as a team physician, community college. I've also worked with Olympic gold medalists before at the Colorado Springs location. So it's been really fun and exciting to be involved with athletes, and it helps keep me young and feeling excited and rejuvenated when I can take care of people with really immediate needs.
For myself, I have worked in the Indian Health Service for 20 years. I have worked both at the IHS Federal Direct, which is places like Phoenix Indian Medical Center, or I'm currently at Gala, where we don't, you do have to be American Indian Alaska Native to come to the clinics, but there's not any like money that exchanges hands. Like, we don't worry about necessarily insurance. We're going to get treated. Then I've worked at tribal centers, and I've worked at urban IHS centers, which also work with a FQHC, so a federally qualified healthcare center. And they've all been uniquely different. And I would say, what I like, similar to Dr. Stern, is working emergency and just taking care of people's immediate need. They come in a lot of pain, haven't been able to sleep for a few days. You're able to assess and help them, and within an hour, they're out the door feeling great and able to carry on with their day. Because if anyone's had a toothache, they know it just affects every aspect of your life.
Thank you. I like how in both responses, the key focus was revolving around the patients and the care and the relationships you're able to build. So what's great about medical pre-health pathways, that there's different options to figure out what you would enjoy best in your daily life and how you can incorporate that into a career. Thank you for sharing. We have one attendee who would like to know how you decided on your pathway. They're a college freshman and they are determining what they would like to pursue.
Go ahead, Dr. Stern.
Okay, thank you. Yeah, I'll address that question. Thank you so much for attending. And I really think it's important to maybe consider attending our American Indians Assessing Health Professions program. And Satima was able to participate in that program and loved it and can speak to that. And so what I would say is explore as many opportunities as you can. If you have the opportunity to shadow a dentist, shadow a physical therapist, shadow a doctor, if you don't know how to find one, reach out to your pre-med advisor or pre-health advisor at your college, see if there's opportunities that way. Contact a local clinic, see if there's shadowing opportunities, because I think once you are actually with someone doing their field, then you get a little better idea. That's how I came to my pathway. I really was excited in college about being a physician. I didn't really know earlier on. I was engaged in sports and athletics, and I thought I wanted to do something different, but ended up settling on medicine. But when I was able to shadow one of our AEIP mentors, Dr. Terry Maresca, in Tucson, Arizona, that was a wonderful experience because I could go with her into clinic and she would engage me with the patients and the care. And I was right there, and it was really exciting. So I had a big interest in providing general medical care, family medical care. And then I ended up choosing internal medicine, which is a general field. And then with my interest in athletics growing up, I chose sports medicine and found out about a primary care sports medicine fellowship, which is either a 1, 2, or 3-year program, depending on where you do your fellowship. But it was a nice way for me to incorporate my interest in athletics and orthopedics with primary care medicine.
And for me, I was fortunate when I was 15 to be able to go on a mission trip to Guatemala with the Oregon Health Science University. And while I was there, they had a medical team and a dental team. And I was initially assigned to be part of the medical team. And then after the second day, one of the dentists asked that I be transferred over into their section. And that was really where, one, I met a woman dentist. I had never seen a woman dentist before, and had the experience of a number of weeks of just seeing great need and seeing the patients being treated respectfully and culturally respectfully, and getting what they needed done. And that just hooked me. Prior to that, I had always thought I would work in the arts. I did a lot of ceramics, a lot of pottery, a lot of sculpture, and that was what drew me to also dentistry, was working with my hands and having that ability to kind of merge the two areas of science and a profession. I wasn't a very strong student in high school. I, in fact, just squeaked by with graduation. So I attended community college for 3 years to catch up. And I'm very proud of the fact that, you know, it took 3 years, but it was a lot of hard work. But that's what you got to do, that's what you got to do. You'll see the requirements that are needed. Getting through calculus was one, getting general chemistry out of the way, biology courses, all of those things. I took the introduction classes at community college before transferring to university. And so dentistry became my thing, and I started shadowing at the local IHS for about 5 years. And that solidified what I wanted to do.
Thank you for sharing, Dr. Begay. I very much agree. It's so important to keep moving forward. And I agree with both you and Dr. Stern. Shadowing and clinical experience has such a big impact on deciding what career pathway you would like to pursue. Personally, American Indians Accessing Health Professions program was an amazing opportunity to see what a day in the life looks like of different specialties, including dentistry. I highly recommend attending the upcoming one in UC San Diego. We have another attendee who thanks us for the session, and as a pre-health advisor, they have heard about blood quantum and the effects it could have on students. They were wondering if you could speak to this.
Go ahead, Dr. Stern.
I've served on a medical school admissions committee for 5 years, and during that time, as well as other national conversations regarding blood quantum have come up. I believe really where we should settle back down to is the connection to a tribal community. It's not so much about someone's blood quantum, but more that connection to a specific community, because I think that community looks to us as leaders and role models. And so having that connection to a community, the blood quantum is really variable depending on someone's tribe. For example, Cherokee Nation is very large, and they don't look at blood quantum. They look at someone's connection to a relative, an ancestor who's on the tribal rolls, and they are a member of the tribe. Whereas you might have another tribe in a different region of the United States, perhaps up in the Northern Plains or Northwestern United States, where the blood quantum requirement to be a member of that tribe might be 50%. So it's up to the tribes, I would have to say, to determine who they wish can be a member. But when we're looking holistically at encouraging American Indian Alaska Native students to apply to health professional fields, and as they designate themselves, I think it's an individual choice. I know that for some people, it's important to stay connected to a community. They may be a member of many different racial identities, but might just choose American Indian Alaska Native only on their application or on their census forms. And that's really an individual choice. I think what I'm looking at nationally is a way to identify people who are members of federally recognized tribes, because there is a unique relationship with the United States federal government and a trust responsibility as a member of a federally recognized tribe, where the United States has an obligation to provide adequate health care in many different capacities. And so that's a very unique relationship. I think students who have ancestors who are a member of a tribe, they identify but that would be a broader category. And so that would fall maybe more into a racial classification versus American Alaska Native members of federally recognized tribes are more of a political class. So that's the biggest distinction right now. Dr. Begay, do you have any comments on that?
That's exactly what I would have said, that it's up to tribes. They determine their blood quantums, and marking the box is an individual choice. So I agree wholeheartedly.
Thank you both for sharing. We have a few more questions in the chat. I want to make sure we have time for those. Our next one is, how was your experience in medical or dental school? How did you choose what institution you ultimately attended, and was it inclusive?
My experience in medical school was very challenging at first. At first I was experiencing some of that imposter syndrome we talked about, where it was challenging and I struggled with my first exams. But what I quickly learned how to do was to reach out to the test taking advisor and learn some skills that I hadn't learned before about how to get through medical school exams. And I chose the University of Arizona College of Medicine in Tucson because I lived pretty much all of my life in Tucson. I moved there from San Francisco when I was an infant, and excuse me, that was an institution that I was very excited about going back to, and also I had a lot of support there. There was a large American Indian community at the University of Arizona, so that's why I chose that school.
And I attended the University of the Pacific Dagoni School of Dentistry. Initially, when I first was looking at schools, I wanted to stay in the UC system. So I was looking at UCLA Dental School, UC San Francisco Dental School, and that's namely because the people that I had shadowed had all gone to either one of those institutions. Once I had the opportunity to visit with a dental student that was from UOP, he really talked about the type of culture that was at that school, and it really resonated with me. So going to the school for a day even, and getting a chance to meet students who are actually kind of going through the ringer with everything and getting a sense of what is a day like is really important. So if you have that opportunity and can reach out to a student that's at a given school, whether it's through the ANAMS with AAIP or through the SED, just finding somebody and asking them specifically about their experience there. My school really focused on a humanistic approach, and it was more collaborative, and that reminded me a lot of our own given communities, that it was, once I got accepted, it was a no-brainer. It was, I'm going there.
I do want to mention the Reshaping the Journey. If someone could put that link into the chat box for participants. The Reshaping the Journey highlighted a few institutions around the country who have been really successful at attracting and supporting students through a medical school. And it was a collaboration between the Association of American Medical Colleges and AAIP. So it's an over 50-page document, but it's worth looking at the Reshaping the Journey document just to get some idea, because I think it's important to, as Dr. Begay mentioned, to connect with someone at that institution, but also see if there's support at that institution as well, so that you can be successful. Thank you very much.
And that article has a lot of great historical context to it. So that's a great one to look at.
Thank you for sharing that resource. I agree. Each university has a very unique environment, and so finding the best environment that is going to work to support your needs is so important. Our next attendee has questions about some of the barriers that you faced when pursuing your career, and how did you overcome them?
I think my first barrier was a financial barrier. I moved when I was 17 from Oregon to San Diego, where I didn't know anybody and I was on my own financially. So during my undergrad, I worked full time as well as going to school full time. And if I look back now and I had to do something a little different, I probably would have taken some student loans at various times. Just because when you're working, that's time away from your studies. And it took me 6 years to get through my undergraduate degree. And a big part of that was because of my workload that I had, not at school, but just working 30, 40 hours a week at 2 or 3 different jobs. But because if you don't have financial support from relatives, parents, scholarships, you got to do what needs to get done. That's just the way it is. So I did learn from those experiences in terms of professional development, but I would have definitely taken some loans during my undergrad. Dr. Stern, anything from you?
I definitely had barriers every aspect along my career, from being in college and being told by my pre-med advisor that I was never going to get into medical school. So I kept pushing and taking as many courses as I could and attending a AEI pre-admission workshop in college. And then I was a participant in, which leads to the next question from one of our attendees, is I participated in the minority medical education program. So I found that when I was struggling early on in college with test taking and time management, by attending MMEP, which is sort of the first rendition of SHPEP back in the early 1990s, it provided me test taking skills, opportunities to collaborate, shadowing, research exposure. So it's a 6-week program. So it was wonderful to be able to engage in that program and meet students from Canada and the United States who are also facing similar challenges. And then in the medical school, as I mentioned before, test taking was not my best, and still I struggle a little bit with standardized exams, but I think finding the right resources and doing a lot of practice sessions. I did purchase and participate with the Kaplan program for a lot of my standardized examinations, all the way from college through to my American Board of Internal Medicine exam. And I found that the Kaplan questions for me were really helpful. And then for professional barriers, I think it's hard to be a woman in medicine. It's hard to be a woman in academia. It's hard to be a woman of color in academia and medicine. So just standing strong and being humble and not engaging in too much imposter syndrome thinking, and really finding the support in my community. So that's a big reason why I stay involved with AEIP, and I volunteer a lot of my time, because that gives me the strength that I need to get on in the big world that we have, where we are continuing to face nationally so many challenges in the area of equity.
Thank
And
you
I
for
noticed that that's a discussion that's going to happen. Oh, I'm sorry, Satima. Just a discussion that's going to happen later on this afternoon with this virtual fair.
Do you want to mention your experience in SH? What was your version? It was the SMDEP, Dr. Begay?
I was not, they didn't have an SMDEP yet.
Oh, they didn't. Okay.
No, it was still medical driven when I was going through my
Oh, it
school.
was. Okay.
The Summer Health Professions Education Program now offers dentistry pathways too. So I remember
Yes.
when I was completing it this past summer at Columbia, there was a dentistry cohort, and there's really amazing opportunities to get hands-on experience, drilling teeth, learning how to use the tools, as well as just motivational speakers and getting exposed to different pathways. Highly recommend applying. And with that, I would like to deliver our closing remarks. As we're wrapping up, we want to just thank you all and express our gratitude to each and every attendee for joining us today. Your participation has truly enriched our discussion and made the session a success. And before we part ways, we just want to remind you that the application deadline for the Summer Health Professions Education Program, PHP, is fast approaching. So please be sure to submit your applications by February 5th at 11:59 p.m. Eastern Time to be considered for this amazing opportunity. Also, please be sure to follow us on social media at SHPP Connect to stay updated on future events and resources. Thank you all so much. Thank you, Dr. Begay and Dr. Stern.
Thank you very much.
Thank you both.